welcome to today's video where we will have a look at stem cell supplements for diabetes. In this video we're going to have a look at whether stem cell supplements for diabetics work. Let me just start with saying that there are no magic pills, but there are pills that can help us heal in many different ways. And I want to address type 1 and type 2 diabetes separately because these diseases are completely different. Type 1 diabetes is an autoimmune condition where your immune system attacks the beta cells in the pancreas, which is the cells that produce insulin. When they are destroyed, you lose your capacity to create insulin and you will need to be on insulin injections for the rest of your life. At least that's the theory and seems to be true in most cases as of today. There are currently some human trials looking at stem cell therapy and type 1 diabetes in newly diagnosed patients. And they have found that 1 year after the treatment, insulin production had more than doubled in the treatment group, whereas it had continued to decline in the control group. Unfortunately, to my knowledge, there are no clinical trials for those who have been diagnosed with diabetes for several years. But in theory, it could as well work for these individuals. When it comes to stem cell supplements, there is no research or trials going on. My educated guess would be that it can have an impact, although not as large and quick as with stem cell therapy. Nor will it cost as much, so it's a more affordable approach for most people. If you are a type 1 diabetic and want to try this, I would encourage you to watch my previous videos on the most important ingredients in any stem cell supplement and get a high quality product and test it out for a minimum of 6 months, or preferably a year before you decide whether it works for you or not. When it comes to type 2 diabetes, there is anecdotal evidence that shows us that stem cell supplements can affect blood sugar levels positively. However, to my knowledge, there hasn't been any research on humans to verify whether this is due to increased pancreatic function, something else, or a placebo effect. In theory, stem cell supplements should work really well for type 2 diabetics that have decreased pancreatic function, because stem cells are able to find cells that are damaged or has a decreased function and transform themselves into the same type of cell to replace the damaged cell with a healthy one. So as long as you have some functioning beta cells in your pancreas, stem cells can start populating the area and turn into fully functional insulin-producing beta cells. When you start taking stem cell supplements as a type 2 diabetic, it's equally important that you find a high quality product and give it some time. Since it generally takes some time for stem cells to renew a large proportion of any tissue, and you can't direct them to the pancreas as you can with stem cell injections, it's important that you give it at least 6 months to see if your condition improves. I have, however, heard about diabetics who have seen an almost immediate improvement in blood sugar, but that may not be the case for everyone. So do your research, be patient, and take note of your results so that you know. Thank you so much for watching. If you like this video, please give it a thumbs up, subscribe to the channel and hit the bell icon so that you will be notified whenever I publish a new video. And in tomorrow's video, I will talk about what the research says about stem cell supplements. I'll see you there.